At Cascadia, when we think about traditional health workers, what comes to mind first are our peer wellness specialists. And peer wellness specialists at Cascadia are individuals who have lived experience, so individuals who identify as having a severe mental illness and then want to be employed by a behavioral health provider to help support others who are experiencing some challenges at that time. So within the programs that I oversee, our peer wellness specialists actually work with clients one-on-one and in group settings to provide information to support their health and wellness goals. So that could be around diabetes management, it could be around monitoring your blood pressure and thinking about how that relates to stress and anxiety, or it could be as simple as going out for a walk with someone to increase their physical activity. The traditional health workers or our peer wellness staff provide the education and the support in both individual and group setting, and they're also part of a larger team. So our peer wellness specialists, they work with the psychiatrists, the nursing staff, the counselors, the skills trainers, and the case managers, and everyone comes together to support the whole person health and well-being of the people we serve. With our integrated care program, if someone's interested in peer supports or health and wellness information or primary care, the staff or the individual will just refer to the program, and then that individual is assigned to a peer wellness staff. That peer wellness staff reaches out to the person who's been referred to the program. It does some outreach and engagement, talks about what the program is, the types of services that we provide, what that particular staff can do to provide, and then the individual decides if it's something that they're interested in pursuing. We do have peer wellness specialists that work in supported employment, supported education, within our Forensics ACT team, within our ACT team in ICM. We have a peer wellness specialist that also works within Cascadia's centralized intake team. So they're spread across the agency, including in residential programs and our forensics programs as well. And then depending upon the program, the scope varies a bit with their position. Having pushed the scope of what behavioral health care does to be more focused on integrated care and health and wellness, I think we've seen some requests that maybe aren't typical in a behavioral health care setting, but are well within the scope of the services that we can provide. So I think it's helping us think about really what our roles are and how we can best support people, and not necessarily in the traditional kind of way either. So when I think about unique qualities that a peer staff can bring, I think it's just the sense of understanding what someone's going through. I've gone to school. I'm very fortunate to have gotten my master's degree in public health, and academically, I can understand a lot of things. However, I haven't felt some of the same experiences or felt some of the same challenges that some of our clients do. If I have a client who is interested in losing weight, and me talking to them about ways they can lose weight, whether by increasing activity or trying to eat healthier, or maybe instead of having soda, having ice water, that information is going to be heard very differently from a person who's actually lived that same experience and had that same challenge. So I think by having peer providers, they're individuals who kind of get what our clients are going through and get it in a way that you can't get it through a book or through academic, in an academic environment. So it's role modeling at its best, right? If you have a client or if you have a peer staff who has worked and they have had, maybe they have bipolar disorder, or maybe they have schizophrenia, and they've lived, maybe in poverty or low-income housing, and they've managed to overcome some of their challenges and lose weight, well, that's very empowering for someone who's in a similar situation, also trying to do the same thing. And I think making sure that they are oriented and brought onto the team like all other staff, because they are a member of that staff team, and they should be oriented in the same way. For me, I didn't know a lot about peer services before I got into my current role, and what had me convinced is just the stories of seeing how much people benefited from peer service and how powerful and impactful and meaningful peer services are for the individuals that we serve. So as our integrated care program, as we kind of branched out and we're going to different sites, we always shared stories around the benefits of peer services and really hope to make people understand the real life impact of what peer services can do and how they can support our clients.
We meet the patients where they're at. Again, not necessarily at home, maybe under a bridge, maybe in a corner, wherever we know that that's where they're going to be at. And we establish a relationship with the patients to give us this information, because we'll say, hey, I'm trying to get you compression stockings. Where are you going to be at? Where do you hang out? Housing here in this community is huge, and a lot of the times we really can't connect patients with housing. We try our best. I mean, my gosh, we try our darndest to be able to figure out what we can do for that patient. But if there's nothing, the patients at least feel comfortable that there is someone out there that is helping them, that is working with them through the process of applying for places, and we're advocating for them to be able to get in sooner. If we can talk to an organization or to apartment complex that we know that we can do something to get the patient in there sooner. Again, because some of our patients need CPAPs, they have a lot of illnesses that they do need to have stable housing. So the patients, knowing that we're advocating for them, we may not be 100% successful, they do feel better and they're able to focus a little bit more on their health issues, their medical health issues. Any medical practice would be insane not to have community health workers, because this is what helps the providers' jobs. We work really close with the providers, we work really close with their nursing staff, we work really close with behavioral health. When we work with a patient to remove their barriers, we get the input from behavioral health, we get the input from the providers. We need to know, first of all, where the patient's at in their mental capability. But in order for us to know that, we have to ask our behavioral health specialist, because if he is working one-on-one with someone, with a patient, we need to know, can we reach out to this patient? Is this person emotionally stable for us to be able to dig in a little deeper, to be able to help the patient with a little bit more, remove some certain barriers? Or the behavioral health can say, yeah, if you can help this patient, but this person really isn't at a point to engage that much, give him the information, we will work later on with this patient, we'll continue later on. There are some patients that we may only work with once for 10, 15 minutes. There may be some that we follow for months and months and months, up to a year, 2 years, however long it takes for the patient to feel comfortable, and the patient will continue to be engaged with their medical team. The community health worker role is very special, and I believe that there's a community health worker in everyone, but not everybody wants to work in this field. Having the compassion for patients, knowing that you can go the extra step to help someone else, and really, really being an advocate for your patient, having that heart, that's what makes a community health worker a community health worker. Knowing that this person is going to be able to find out where the patient is in their lives, how much assistance the patient needs, be able to determine those, not just give a patient a phone number and say, hey, here, go ahead, this is a resource I found for you, go ahead and give them a call. But working with their team, being able to work with the team and asking, how much help does this person need?